So how does Chinese medicine differentiate disease?
This is a very good question. The basis of TCM diagnosis and subsequently TCM treatment is the methodology we call differentiation of syndromes. This is what makes Chinese medicine such a unique and effective medical system. The focus of TCM diagnosis is the identification of the root cause of the disease, and this informs the treatment. What does this mean? It means that we can have two patients with the same chief complaint, for example, cluster headaches, but the cause can be completely different. So we will identify the cause using the 4 diagnostic methods. These include observation or inspection, which means evaluating a patient based on how they look. For example, one patient may have a pale complexion and another may have like a red or malar flush. We also use tongue diagnosis as part of this diagnostic method. A patient's tongue is like a gateway to the interior of the body and can provide extremely important diagnostic information. The second diagnostic method is listening and smelling. This means listening to the sound a patient makes, including the sound of their voice. And smelling refers to the odors that a patient may emit. You may see this more like in a hospital setting. The third diagnostic method is inquiry. This is the patient interview where we'll ask the patient history and also ask what we call the 10 questions. This is to help us to evaluate the patient's accompanying symptoms. Last but not least, we use palpation, which may be the most important of the 4 diagnostic methods. Palpation can include palpating the abdomen, the lower back, the head, the neck, the channels and collaterals, which is sometimes called the meridians, and of course, the pulse as well. If you've ever been to a Chinese medicine doctor, you've probably had your pulse taken. Once the practitioner has conducted the examination, they will use all of the information to determine the root cause of the condition, what we call differentiating syndromes. And this will inform the treatment plan and how we treat the root. So going back to our example, we may have 2 patients with cluster headaches, but with entirely different causes. One patient's cluster headache may be caused by blood stasis or stagnation, so kind of like a stuck blood in the body, and the other may be caused by a blood deficiency. These 2 patients will be treated with entirely different approaches. Conversely, we may have a third patient that is a completely different chief complaint, for example, insomnia. And this patient may have the same root cause as one of the patients with the cluster headaches. And those 2 patients would be treated very similarly. This is the beauty of the Chinese medicine diagnostic and treatment system.